Sweet. So, I mean, that's all sorted. I've never really had an introduction for all this, by the way, but I feel like it's weird to have like, welcome back to this episode or whatever. But Adam, thanks very much for coming on the pod. Really excited to have you on. But why don't you just start off things, introduce yourself, what position you are, and then yeah, we can get going.
Yeah, no worries. Very, very happy to be on. Grateful to be to be asked to go on the pod. Yeah, so my name's Adam. I'm PGY2, a PGY2 doctor. So for those that don't know what that means, it's basically your second year working as a doctor, postgraduate year two. I'm based in Melbourne. Currently going through a few different rotations and figuring out what I like, what I don't like. But I'm on the BPT stream, so the basic physician training stream. For those junior doctors, you might know what that means. But yeah, I'm just kind of in the process of trying to figure out what to do with my life, and then also have a bit of a hobby YouTube channel on the side, which I enjoy making videos about a few different things. So far, it's mostly been about the GAMSAT and about being a doctor, but yeah, it's an enjoyable hobby. I don't know sort of how you got into YouTube, and you seem to be enjoying it, but it's good fun.
Well, yeah, I've got a few reasons why I wanted to get into it, but yeah, I guess the main thing was like just a frustration of the lack of information out there was like the crux of it all. And I don't know if that's a sort of a similar motivation for you starting out with everything. Like I know you sort of like have an interest in like food and stuff as well on the side, and maybe it's like doctor food sort of thing combined, which is cool. But I don't know. For me, it was like a lack of information that questions that I wanted answered that weren't. So I was like, oh, I'll just figure it out myself and then answer my own questions.
That's so good. I think one thing I've learned from YouTube is that people come to find these sorts of answers to answer questions that they don't know how to answer themselves, and they look for people that have gone through that process before. And it's been pretty cool, I guess, putting out videos about your own experience and going through the GAMSAT or getting into medical school, or your experience of being a doctor, and people being like, "Wow, that's actually cool. I found that really helpful," and it's gratifying being on the other end of making the video. And yeah, I guess motivates you to put more videos out there.
Exactly, exactly. And I mean, you started how long ago? Was it like a year or so, or maybe a little bit longer?
Yeah, a touch over a year, I think, since I made my first video, and it's been kind of a battle to build consistency since then. But every now and then, I'll put out a video about a topic that either I thought I wanted to know more about when I was a medical student, or earlier on in my junior doctor journey. It's still early on, but and yeah, I kind of enjoy the crafting process of drafting a video, coming up with an idea, filming it, editing it. And I think at times I'm probably a little bit too hard on the perfectionist side of things, of trying to like make sure that everything's like right, and that probably delays things a little bit. But it's been really good fun, and it's the more I've gotten into it, the more I'm like, this is something I'd love to continue throughout my medical career, no matter where I end up.
Yeah. No, I think it's at the base of it. If nothing happens from it, it's like you have a skill at the end of the day, which is a skill that heaps of people don't have. And I reckon it's just like really cool to like learn about, that whole video editing, filming, uploading, the whole like atmosphere of like social media, and then trying to navigate quite an anti-social media field in the medical profession with that, YouTube side, which is so helpful. I mean, so it's a tricky place. I don't know if you've had much pushback from anyone, or if some input from colleagues, or whatever you've experienced. But I think it's been like a mixed bag from my point of view.
Yeah, I'd say I'm probably my harshest critic at this point. I don't think I've received any kind of backlash from anyone that I work with or colleagues. Not to be honest, no one really knows about it. I haven't really been super vocal. I haven't told many people about the channel. It's more just been my own kind of personal project. A few people have sort of come up to me every now and then, being like, "Oh yeah, I've seen your YouTube videos. I'm trying to get into medicine. Can you help me out?" But I think in terms of what kind of content I want to put out, and I guess anticipating judgment from colleagues is always a challenge that you're going to come across. It's probably the biggest barrier that I found to starting and to making a particular video and being like, is this the kind of thing I want to put out there? What would people say about it if they, came across me on an average shift and then went home and saw this type of content? Is that the kind of thing that they'd be happy with? And I think it's trying to strike a balance between what other people think and then making things that are, I guess, genuine to you and the type of thing that you want to be making.
Yeah, it's definitely a tricky space that like to navigate, and the goalposts constantly shift. And as long as you're, you got the finger on the pulse, you're just thinking about those things, I think you have a good outcome in the end. And if you won't stray too far away from what you should be doing if that's the case, which is cool.
Yeah, yeah, absolutely. And I think, I guess, just one thing to touch on watching your videos, I love just how, I guess, reflective you are in the Junior Doctor series videos that you've been making. I think it's pretty cool because it's hard. You can't really take a camera into work and film every aspect of your day. It's just like it's not possible as a doctor, but being able to kind of get that real or close to real time feedback and the emotions that you feel, the experiences, it's kind of cool. I don't think and I think a lot of people that don't work as a doctor would watch that and be like, okay, now I get sort of a bit of a feeling of what it's like.
Yeah, it's a tricky space where it's like you can't you want to show so much, but maybe you just can't and you shouldn't. And then it's like often I found in that drive home or that drive into work, that's when, especially if you've got a big day coming up, or maybe you got an exam or an interview or a big operation you're going to be a part of, or maybe you've just finished a massive cover shift and some patient has like passed away for whatever reason, or you thought you could have done a bit better. That's when like your mind is like racked by thoughts, and then the I don't know, if you don't want to just go and bring that home, you can sort of just debrief in the car on the drive home, which is I guess what that sort of ranting series has turned into, just like an offload for my mental health, which is cool.
Yeah, I think it's so important. I've definitely had many thoughts on a drive home, reflecting, ruminating on things that have happened, things that you've done well, things that you could have done better. And I think it's very healthy to offload that kind of stuff.
My motivation is to make a new series where I don't know how it'd work and how it'd fit in, but like it'd be called like Doctors Drive In, where like you go and pick up someone, drive into work, have a chat, like an interview chat with them in the car, and then it'd be like Doctors Drive In or Doctors Drive Home, whatever I could figure it out. But the logistical side would be trickier. The actual like filming and like the content would come so easily.
Yeah, I think that's an awesome concept. You should definitely explore it. Kind of like that Jerry Seinfeld Netflix series where he gets a bunch of what's it, comedians drinking coffee or whatever.
Yeah, comedians in cars drinking coffee. It's great.
Yeah, yeah, so good. And I think you'd have such good chats with different people in medicine. And so often I find that like when I'm at work, the best conversations that I have with people that I work with are about things outside of medicine or their thoughts surrounding it, not just reflecting on the job itself. So I think you'd get some cool things.
Oh, for sure, for sure. But let's go back to you where it all started. Like medicine. I mean, people hate this question, and every time I like even think about it or get asked it, like I just shudder. I'm just like, oh, it's just the worst question. But I mean, what all started it, mate? And why'd you get into it to begin with, and what was, maybe just take us through your whole journey, like getting into medicine and then doing the whole medical degree.
Yeah, happy to run through it from the beginning. I think, like many people, the story, I guess, kind of starts in high school when you start to think about what you want to do for a career, what you want to study at university. And it probably came up around, year 10 or 11 when you're starting to plan your subjects and that sort of thing, where I'm like, okay, you know, I'm interested in a few different subjects, science, maths, like humanities, I guess, as well. And let's try and put together what kind of makes sense. And nothing really came up. And then I think it was, I think the London Olympics or something like that. And I was watching, and I was like, wow, that'd be really cool to go and be a part of the Olympics. but I'm nowhere near a good enough athlete. And then I started reading about some of the people that go to the Olympics and started reading about sports doctors that would join in on teams and work with athletes at the Olympics or just athletes at the highest level in general. And I thought, wow, that's pretty cool. That sounds like something I could really enjoy and see myself doing. So I started going to some events about sports medicine and then started thinking more about medicine seriously in general, and that kind of opened up my mind about different pathways within medicine and how that works. And went through the old UMAT process back in the day in year 12, and started to think about that a bit more seriously and line up my subjects. And didn't get into undergrad med, unfortunately, and sat the UMAT a second time and got an interview, but still didn't get in. So I went through the biomedical science pathway, which is a fairly common pathway for postgrad med students in Australia. So I think a lot of people will be able to resonate with that. And again, my kind of idea of what I wanted to do in medicine shifted a little bit. I really enjoyed the public health side of things, being able to prevent diseases before they happen. And then went through the process of applying to medical school again, sat the GAMSAT, went through interview process, and yeah, finally got into medicine. So yeah, I was a postgrad medical student and finished 2 years ago now, and just wrapping up on my second year working as a doctor. And yeah, constantly things are changing. Constantly, my idea of what I want to do for a career changes, and but I'm getting to that fork in the road where you have to kind of start to think about your career and what you want from it, and that's been an exciting but interesting journey, and probably, I guess, the birth of the YouTube channel in a way, a form of like reflection and introspection of what I want to create from my medical degree.
Yeah, it's an interesting, it's a common but like, unique pathway in itself where everyone goes through these like little hurdles to get through, and you constantly like faced with like different hiccups or like speed bumps along the way, and you're like, oh, I failed the UMAT, or I didn't get in, I didn't get my interview sucked. Should I keep doing this? Should I like keep cracking on and having another go? And yeah, you see people have like, 3, 4, 5, 6 shots at this GAMSAT, and then they don't get in, and it's constant battle of like, does this mean I'm going to be a good doctor or not a good doctor? And well, just do whatever it takes to get in, and then like how you be like with patients, and if you're like a genuine like good person to chat to and like hard worker. I think those are the main things at the end of the day. It's just all this you know tediousness at the start.
Yeah, it's super tedious. And I think people often say, like, medical school is hard, but the uncertainty around getting into medical school is probably a bit of a different challenge in itself. But as streamlined as that journey sounds, and as common as it sounds, I think everyone's got a slightly different slant to how they got in and why they wanted to do it. And I think, yeah, it's a process that you look back on kind of fondly, but you're very happy that you're done with it and you kind of have got across the other line.
Yeah, exactly. But then now you're like at a different fork in the road, as you said, and it's like, well, what do you want to specialize in, and how can I like navigate that pathway? And that's honestly my current pet peeve, is that you have to go through all this stuff while you're working and figuring out how to get all these points and all these like, different pathways, and how many attempts I have at getting into this specialty. And you hear of people who don't get in after their 3 attempts, and then they have to, change specialties completely. And yeah, I guess for anyone listening who doesn't know about this, like different, specialties have limits on the amount of times you can apply for them. So say you have your third attempt and you're unsuccessful at applying, say for orthopedics or general surgery or whatever it is, you actually can never apply for that specialty again. And it's like, well, what if that person just quits medicine after that, or what if they do something different? I feel like that's a wasted opportunity as a doctor. So it's now that, which is like, we should probably change that, that system. I don't know. I've got a few thoughts on that, but, have you ever thought about like changing the system, or what it would be like, or how you would, redesign it if you had the opportunity to?
Yeah, I do every now and then. I think the surgical system is very challenging to navigate. Seeing so many amazing, prospective trainees doing so many unaccredited years to get on the program and eventually get to the point where they can commence training for real. is such a huge hurdle to go through. And I think it's reminiscent in a lot of other specialties as well. The point system that a lot of specialties have, I think it just kind of dehumanizes the whole process a little bit. And I think that people have so many amazing individual skills that aren't really reflected in that application process. So I think, yeah, it's hard when specialties are becoming more competitive to delineate different applicants. But at the same time, I think you have to find a way that I guess makes it fair for people that are going to be really good and that really want to do the specialty and for try for many years and then can't make it through. So yeah, it's a challenge.
I think my pet peeve comes from not the fact that it's competitive and there's like a point system, but it's like if you don't get in, then you have to change tack completely, and it's like the uncertainty of, well, I just might be a resident or an unaccredited reg for the rest of my life. Whereas like I don't know, there should be like obviously there's going to be competition and there should be some system which has to decide whether people get in or not. But then if you don't get in, you should actually be allocated a specialty. And I sort of like, I don't know, I reckon it'd be cool to have like sort of a hybrid model between this and the US where maybe you don't get matched before medical school, but you're matched in PGY 3 or PGY 2, and you have a few years of like actually working as a real life doctor, and then you get to say, well, I've experienced surgery. Do I like it? Yeah, potentially. Maybe I'll put these top preferences for surgical specialties, and if I don't get the first one, then number 5 might be all right. And I don't know, maybe that sort of system could be worth exploring.
Yeah, that's a really interesting idea. It's not something I thought of before. I think that could be a great middle ground because I know I look at the US system and I'm like, people coming straight out of medical school, it's a little bit unfair to go into a specialty and know exactly what you want to do from the time you graduate without having really, worked to the role as someone with, some level of responsibility, however little that might be at that early stage in your career. But um, yeah, it's hard in the long term to be able to decide what you want to do without having worked in it. Conversely, in the Australian system, as you said, it can take a really long time and it can be a really difficult process.
Yeah, exactly. All right. Maybe I'll explore this space. I'm trying to write an article. I don't know where to get it published, but it's just like as like that proposed like system which could work. But anyways, who knows? We'll see what happens.
Look forward to reading it.
Yeah, yeah. But you said like this you're on this BPT journey at the moment. Why don't you just take us through, so like obviously you have internship and then applying for your PGY 2 year as a resident or HMO 2, whatever. Um why don't you just explain to people what your options are that you have, because you can sort of fall into BPT 1 just like without applying really, to be honest, right?
More or less. So I guess coming out of intern year, you have a few different options. In Victoria, it'll change slightly. It'll be slightly different compared to some of the other states. But generally speaking, you come out of your intern year or years, and you can either go down sort of a general stream, which is continue doing the same sort of thing, a few different rotations, try things out. You can go through, a pediatric stream, obstetrics, gynecology, that sort of thing, surgery, critical care, and then the other stream, which I'm down at the moment, is BPT or basic physician training. And the way I explain it to my family is it's all the ologies, so all the medical specialties, cardiology, gastroenterology, endocrinology, infectious disease, all of those specialties. And it's the start of that journey where again you're kind of rotating through different areas, different specialties, but they're mostly medical specialties. And excuse me, but yeah, so early on, you're a resident, and then eventually you'll transition to being a medical registrar, and then sitting your exams, your written exams, your clinical exams, and then applying for advanced training in one of those particular specialties, essentially. So I'm in BPT 1, so I'm a resident rotating through different medical specialties, and I'm starting to think about what I want to do within the BPT stream, if it's something I want to continue down. Gastroenterology has been something I'm I've been kind of keen on so far. So it's at this stage where you start to think about research and getting involved in the department, activities, audits, getting to know people, that sort of thing. So that's really the start of the journey, and it just goes on from there and becomes, the exam process, which is the same in any specialty that you go down, but each has its own unique journey.
So what rotations have you had this year so far?
So I've done gastro this year. I've done an ICU rotation. I've done a rotation on nights covering renal and respiratory, and I'm currently on neurology at the moment, and then finish off on gen med. So you get a bit of a mix of things, and the things you don't cover this year, you almost certainly will do, a handful of them next year. So it's been good learning.
It's kind of tricky, right? Because you're constantly like swapping between different rotations. You're kind of like resetting, and you're like, well, I know nothing about neurology right now, but like in cardiology, I haven't done a rotation since medical school, and it's like you're constantly resetting and feeling like you're in the deep end, like each new rotation that comes by, which is the frustrating feeling.
Yeah, absolutely. I think it's the life of a junior doctor. Well, at least in your resident and intern days, moving through different teams, getting to know new people, how that particular department works. And a lot about being a junior doctor is the administrative side of things, which does often change between different teams. So, yeah, there's a bit of a learning curve, but you become a bit more used to it as you go on, I'd say. Have you found a similar sort of thing on your end?
Yeah, but I tried to like just keep doing the same rotation because then I'm like getting good at like one thing, and then you're getting like hyper specialized, and you're like, I don't know. From my point of view, I'm like, well, I've been studying for long enough. I just want to get into a specialty and find something that I'm interested in, hang out with people I want to hang out with, and do procedures and stuff that I want to do. So the quicker I can do that, the quicker I can accelerate and specialize, the better. So I don't want to rotate through all these other ones because I'm not going to. A jack of all trades really doesn't get you anywhere in terms of specializing if it's so competitive.
Sorry, I've got the the dogs are howling in the background. Dude, I'm so sorry. There was a risk that that might happen. I've caused you a bit of editing, additional editing.
Do not even stress. It's all good, man.
Talking about consistency in rotations.
Oh yeah, and just like leveling up and stuff. Yeah, I mean, I don't know. The way I see it is just like I'd rather get good at something quicker. And whether it's, getting good at ED and doing more ED rotations, that's what I would care about if I wanted to do emergency. Of course, if you had time and you had all the time in the world, you could do all these different specialties. But it's just like, I don't know, man. If I did an orthopedic rotation or I did 6 months of ortho as a reg, but I'm specializing in say general surgery, at the end of the day, if I have an orthopedic concern about one of my general surgery patients, I have to ask orthopedics medico legally, and also I don't have time to do an orthopedics review for that. So I look at it in terms of big picture. Like, I'd rather get good at one specialty because that's what your actual job is going to be. But yeah, maybe other people have different points of view, but that's just mine.
No, no, look, I agree. It can be a bit frustrating at times going through rotations that at the end of the day, might form a bit of a nice knowledge base, but aren't going to be the thing that you're going to be dealing with on a day-to-day basis. So yeah, I kind of envy that side of things where you can have a bit more consistency.
Yeah, but you will, right? You will, and next year maybe you have like more like extended rotations. And then the year after that, maybe you just do, I don't know, 6 months of like gastro and all that stuff. So you do narrow down. It happens over time, but I guess for BPT one, you sort of try to get five different rotations, and you have your relieving term on like nights or something as well, right?
Yeah, exactly. So you get a little bit of exposure to things, which I think at the end of the day in BPT or for a physician, it kind of does make sense. You want to have that experience that is going to help you, one, with navigating exams and clinicals and that sort of thing, but also, to make you a bit more generally well-rounded, which I guess is helpful at the end of the day. But yeah, as I said before, not the thing that you're going to be managing on a day-to-day basis.
And then so BPT two, I know like I've got a couple of people I know who do that, and they sort of start looking at like doing a bit of gen med regging, and that's the first sort of deep end step up that they get exposed to. What's the structure of BPT two? If you could take us through it.
Yeah. So the structure, I guess, is similar in a way that you continue with different rotations, but you do, as you said, start being being a registrar for Gen Med, and that's that, I guess, big transition point where you kind of develop a bit more responsibility, and it's the thing that now I'm starting to look towards and think how I'm going to navigate myself when I get to that point. But yeah, so you'll do a bit of gen med regging, and then you'll also be moving through rotations as a resident, specialty rotations to, I guess, yeah, build that knowledge base and exposure again. But yeah, being a med reg, yeah, definitely has its challenges, I'm sure, which I'll find out shortly. But interested to hear, have you done a bit? You've been regging yourself a little bit. How is the transition like on your end, going from a resident to a reg?
Scary, but I think the more time you spend doing reg things as a resident, the easier it becomes. So when you like I like imagine it like you're driving and you start on your L plates, and then you get up to your P plates, and then you're a fully fledged like driver. I mean, the more stuff you can do on your L's, the easier it's going to be, because you've got someone there checking up and running stuff by. So I would do it as a resident where I would hold the phone and I would, go do like operations, and I'd always have someone like a reg backing me up in the room. And that if you act like a reg as a resident, and you almost use your reg as a consultant or a pseudo consultant, you can sort of have like, this experience of what it would be like being a registrar as a resident. So I guess that's makes it easier in the sense that the more reps you put in, I don't know, the easier it gets. It's obviously going to be challenging when it's a real life situation and you're the reg now and you have to make reg decisions, and the consultants there, and they're not. There's no one else between you and the consultant. So yeah, that's what I would do to try to make the experience a bit easier.
Yeah, I think that's good advice, and it's been something I've been trying to take into account a little bit towards the end of this year, especially. Yeah, that change in dynamic, but it's crazy. You go from being a medical student and seeing residents and registrars and looking up to them and being like, wow, their responsibilities so different and they know so much, and then all of a sudden you're kind of at that point and you realize that everyone's just a person trying to do their job and learn and progress and all that sort of thing.
Exactly. It's not as hard as it sounds, but there is like different expectations that I prefer. And I think, I don't know, life as a reg is much better than life as a resident, much as though life as a resident is better than life as an intern. So, I mean, I think it progressively gets better, although there are more expectations and higher expectations and more challenges that come with it. So, I don't know. Are you looking forward to it? Doing a bit of regging next year?
I think in a way I am. I think I'm keen for a bit of a different challenge and a bit of a change up, and I'm kind of, yeah, I'm interested to see how it'll go. Uh, but yeah, then there's obviously a part of you that is a bit nervous about the change, and um, yeah, being a resident becomes pretty comfortable after a while. And but I think it's important to do new and different and challenging things. It's how you get better, I guess.
With it, yeah, the other perspective to take is people say, "Oh, I'm not ready to level up as a reg," and the reality is, yeah, you're not. You're never going to be ready until you start regging, and then you start off and you're like not great, and then you actually get good, and then you like start to actually progress. And I think it's that acceptance of like, oh, you're going to be terrible to start off with, no doubt about it, but over time you'll become like less terrible and actually start to develop some skills.
Yeah, it's cool. It's, yeah, definitely going to be a journey, but every transition point is going to be, yeah, that next level up. And yeah, as you said, can't really anticipate how you're going to react to it until you get there.
Yeah, 100%. And do you have your rotations for next year? all lined up, or
I guess a bit of a change in direction next year, taking the so-called gap year, bit of a year off. Um, I am taking a break from yeah, being a hospital doctor next year, and going to hopefully locum a little bit at the start of the year and move overseas and travel and maybe do a little bit of work overseas as well for the remainder of the year and see how that goes. Yeah, I think it's
as a doctor?
haven't exactly worked that one out yet. I think for me, this experience of traveling and living overseas is something I've always wanted to do. And, if you ask a lot of people in medicine, like now is kind of one of the better times, not that there's ever a ideal time to do it. So, and I think, yeah, depending on whether or not I work in medicine or outside of medicine, we'll have to wait and see. I think part of me is kind of keen on doing something a little bit different and having a different experience and seeing what that's like and if I enjoy it.
I think this this discussion point is very timely because like I literally filmed a pod yesterday about, reflecting why people, tend to take a bit of time away from medicine, and maybe some people actually end up quitting medicine, and they almost get to this stage where it's a couple years in and they're realizing, is this what it's like actually going to be like? And they may have almost come to this overwhelming sensation that they're in too deep or they're not in the right place that they want to be. So taking this gap year or changing pace a little bit is one of the most important things to do to maintain your like longevity in medicine, right? I don't know if you've seen like other people on like YouTube where they're like, I quit medicine, and I'm just thinking, why did you get into it to begin with? Like that's the first thing that comes into mind if you quit 1 or 2 years in. But yeah, I don't know. What are your thoughts on everything?
I have a few thoughts. I have a few thoughts. I think it's becoming a more commonly talked about topic of people who either feel burnt out by medicine or just don't enjoy it anymore, or have made the realization, as you said, that it's not really the thing that they want to do for the rest of their life. Um, I've been doing a bit of work with the team at Creative Careers in Medicine, which is an awesome Facebook group. If there are any Australian doctors or doctors anywhere listening and want to join the group and learn a bit more about some alternative career pathways or people that have just utilized their kind of clinical skills in an interesting way, then go ahead and join the group. But essentially, it's exposed me to a lot of different doctors who are at different stages in their medical journey, either consultants, junior doctors, and are beginning to you know use their title as a doctor and use their clinical expertise to do really cool and exciting things, just to change up the way that they practice and how their career looks. So I think from one perspective, that's really cool, and medicine kind of allows you to do that. It's a very specific skill set, but also it gives you a pretty broad range of transferable skills. Having said that, I have seen a lot of those videos recently on YouTube of people like, I've quit medicine. There was that one that went viral not too long ago. I don't know if you've seen it. I forget his name, Gooby or something like that. He was a neurosurgeon in the and it's wild because particularly specialties that are so intense or perceived as so intense, such as neurosurgery, you think that people are really invested and motivated, and you don't really see that other side. And so it has been kind of interesting to see their perspectives, and it does make you think about what are your priorities in your career and in life. But at the same time, it is hard to see people leave medicine and go, and it's there's that sunk cost fallacy as well of like, wow, you put so much time and effort into this and now it's just all gone. But yeah, I can rant about this for a long time, but I think there are numerous ways that you can use your medical degree and your clinical skills, and if you can find a way that you really enjoy, and do that, then I think you should go for it. But yeah, it's definitely becoming a more common theme, I think, amongst doctors.
Mm. Yeah, I mean, I spent about 36, 30 or 36 minutes ranting about it the other day. So, like, I definitely have a fair few thoughts on it as well. But it's, I don't know. I think if people take away the fact that it's like just a medical thing, like people get into whatever career and realize, oh, this is it, and this is like what it's going to be like, and I don't know. Maybe they just didn't think that hard about it, or didn't think how their life's going to evolve with it. I think the main thing what people could do to try to combat that, as you were saying with the creative careers in medicine, like combine other stuff with it, or make sure you're doing other stuff and it's not just like a be all end all situation where I have to my whole existence and identity is aligned with life as a doctor. If that's the case, then maybe that's not going to be that fulfilling for you. But if you can, as you say, take a year off, do some locuming, take a year away from medicine, uh, make it move dynamically with your life rather than it being your life is the main, transition point.
Yeah, I couldn't agree more. I think you brought up an interesting point about identity. I think for a lot of us, in medicine especially, the medical personality, where our identity is just solely, way too tightly tied to our job as a doctor or our career in medicine. Um, Whereas it's so important to have things outside of medicine that keep you going. And even if you don't take a year off or try something different, I think it's important to like reflect on what things you have going for yourself outside of medicine, and focusing on having that kind of quote unquote balance, whatever that actually means, really. But yeah,
It's another can of worms, to be honest. But
yeah, seriously, I've come to the point. I don't think there's ever such thing as balance. I think it's just doing your best whenever you can.
agree. I agree. I remember being on a what is it, an aged care rotation, and a geriatrician was making a good point, and just about like that whole identity situation. And you see people who completely like they completely identify with their job or occupation, and when they're deprived of that, for if it's a medical condition, if it's some sort of accident or deterioration in their health, whatever situation, and they're not able to work, and that's their identity, they really lose their sense of self and really deteriorate and go downhill because they literally have lost their identity. And that's the whole thing that you were saying. Like, you need to have a balance of other things, whether that's like actual work life balance or whatever. But just do a whole bunch of things so your identity is not aligned with one thing. Um, and that can actually be like healthier for you. But that was like an interesting point that I never really thought too much about until like that specific patient that we came across.
It's yeah, such a like strong and important point. And I guess also on that, you have a bad day at work, and maybe you make a mistake, or you're too harsh on yourself, like we often can be, and you start to think like, oh, I'm not a good doctor, or like I'm a bad doctor. And if being a doctor is your whole identity, then it's easy to slip into the trap of thinking like, oh, I'm rubbish. If I did something crap as a doctor, it means I'm a crap person. But in reality, it couldn't be further from the truth. I think we're just too hard on ourselves sometimes.
So, all right, this is cool. So you're planning like a year off next year. You're maybe going to do some locuming. You're really going to change up the pace of things. That sounds really good. Are you going to like locum around Australia as well, or just sort of um, like, I don't know if you're planning on living in the same area, or if you're going to like literally pack up shop and travel wherever. But yeah, what's your plans?
Yeah, it's a good question. I haven't quite figured that out yet. It's a work in progress. It's what I'm trying to sort out at the moment. I think I'll probably just try and hop on the shifts I can get in the time that I have before I head off, whether that is more locally in Victoria, or more so around Australia. Um, it would be cool to have that experience of working in different hospital networks. I've only worked in the same network in the last 2 years of being an intern and a resident, so it'd be cool to step out and see something a bit different, and maybe see a different part of Australia and a different demographic, a different you know more coastal regional area could be fun. I think a lot of people seek that sort of thing out. I hear a lot of locums going to Byron Bay and that sort of thing.
I think that's a really good thing to do. I think moving out of a different like health service and stuff can only be good for your different like skill set as a doctor. More like strings to your bow. as it were.
Yeah, yeah, absolutely. And I think, yeah, got a cool chance to see a different part of Australia and work with different people for sure. Yeah, locoming can be pretty handy to be able to do that.
Go to work, you know, get a bit of cash, learn some stuff, because you should, like that's like you want to just like be able to like learn. You don't want to just go and run away and get your pay slip. But I think that'd be a missed opportunity. But there's no like sense that you need to do more, which I think a lot of, like as you said, life as a junior doctor is about impressing and getting the leg up on other people in order to get your place in the training program.
Yeah, for sure. Yeah, you can definitely just go and do the job that you have to do, learn a few tidbits along the way, and then yeah, go home without those extra strings attached. It's yeah, it yeah, it can be quite nice. I think I'm still in the early stages of it, but keen for the whole journey.
And what are you going to do about your dog as well? Is that yours, or is it just one of the housemates or families?
I popped on over to my parents' place. It's just a bit quieter at the moment. Well, so I thought until the dogs started yapping out there. But yeah, so the parents will take care of them. Very cute, two cocker spaniels. Big fan. Would want some dogs in the future, but not just now. I think it keeps you a bit too tied down.
Yeah, no, thank you. Dogs are great. I'm a dog person, but they're a child. You can't go life as a doctor and do a 14-hour shift and then have to walk a dog at the end of that. That's it's just not happening.
Yeah, no, I can't be handling that at the moment.
And when do you sit the exams as well? Like, because obviously BBT, is it two or three? You sort of maybe three, right? You sit your exams.
Yeah, 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 exactly. So BPT 3, you start your written exams. That's when you sit them, but obviously start studying generally at the start of BPT 2. Um, and that's when the process begins. So there's the written exam, and then there's a clinical component, which involves more, your long and short cases. As if you're, a junior doctor, you might be familiar with that sort of concept. But um, yeah, and I think it's just a whole journey in itself. It's not something I've fully uh, dived, headfirst into just yet. But yeah, I think studying and exams and working at the same time, yeah, sounds pretty rough. How have you managed with that side of things?
Um, Not great. I mean, you start off and you think, oh, this is going to be good, and you have a quiet week, and you're like, I can definitely do this, and then you have a really busy week, and you're like, oh no, I don't have any time to do this, and I like explored different points of view with like doing like a daily sort of planner versus a weekly planner, and I think just starting earlier and getting more reps in and studying whenever you have time, just like PRN is better. Sticking to a rigid schedule is not, it's just not really permissible. I mean, you'll have a shift that runs 2 hours overtime, and then you'll have to, get up at 6 a.m. and you deprive yourself of sleep, and you actually put yourself and patients at risk. I mean, it's just like, not it's not feasible. So you might just have to spend an extra 3 hours on a Saturday when you've got time to do the questions, and that's just what it looks like. So sticking to a daily schedule, I found, was just a bit unrealistic. But I don't know. I'm not an expert at it because I missed out on this GSSE thing that I have to do again next year. So I'm just gonna, do it. I'm going to take a year off as well next year from clinical practice, and try to do a bit more study and research. So hopefully I can get those exams done as well.
Wow. Okay. Yeah. Those exams are so tough. The surgical science exam. It sounds, yeah, just like an absolute, you know, slam your head against the wall type situation. But yeah, it sounds like a pretty rough exam. So yeah, next year, taking a year off sounds amazing. So you get a chance to do a few different things, and yeah, focus on that stuff would be a bit better than having to try and cram everything in with life and work. And oh, it's so rough.
Yeah, I mean, it's like it gets back to your personality, right? Like, I don't really care. Like, I'm very much, I'll get bored easily. I have to do something and really like hyperactive, sort of like, I want to always be like, I hate sleeping. I hate sleeping in. Like, that's just like a headache for me. So I don't mind to do it, but when it gets a bit too much, then it can actually, negatively spiral. So yeah, it's a tricky balance to pick, but yeah, working and studying has its own challenges just as much as working and having a family or kids or a dog or whatever. So whatever works for you. But I think starting earlier just gives you a bit more of a buffer, you know.
Yeah, yeah, for sure, for sure. I think everyone's going to have their own way of studying and managing these things. I personally am the kind of person where I go through, 7 different productivity things that to try and figure out what works for me at any given time, and it's a constant struggle. I'm a big Notion fan at the moment. Organize my life through Notion, as half the medical cohort on YouTube is as well. But yeah, it'll be interesting to see how I navigate that whole process.
Yeah, well, Notion's good. I've seen you have a few like products on there, a few like little templates and stuff. I really like it. Like Notion's very good to just simply organize things, and yeah, I'll put your link and your socials in there. So if anyone wants to check out your stuff that you got going on, because you also sell it on like Gumroad or like list a few products on Gumroad too, right?
Yeah, totally. And that was more just, I've made a few videos about that sort of thing. And I basically just replicated the same system that I used and chucked it on a template, a Notion template, and put it on Gumroad. It's completely free. People can just download it and use it however they like and change it up or whatever. But done some other things for the GAMSAT as well. It's just, yeah, nice having something out there. And I guess from a from a YouTube point of view as well, it helps create that kind of community around you that help provide value, hopefully, and people find it helpful. So yeah, it's good.
For sure, for sure. Well, Adam, we should probably wrap things up, man. But I reckon if you had like I don't know a piece of advice for anyone sort of thinking about going down this BPT pathway, specifically, but maybe any like general medical advice or whatever for someone going into medicine or as a junior doctor or anything you've thought about recently that you wanted to like sort of pass on. I'm sure you've got plenty of messages in your YouTube videos, and we'll have more to come. But yeah, if you had anything that came to mind, what would you pass on to that person?
I think it would be a very general piece of advice, which is, as we spoke about before, try not to let your identity be too clouded by you as a doctor, and try to find things that you enjoy outside of medicine, because it's going to be a really long, like very difficult and lonely journey if you're just doing the one thing. And yeah, try to find value in those things as well, as best as you can, and do it your own way. Everyone, has this idea of how medicine should look like and how getting to the next stage should look like, but we're all different. And I think that if you listen to everyone else, then it's probably going to be a harder process. The one of least resistance is probably going to be the one that where you do your own thing and you follow your own path. So yeah, just try and do that as best as you can. That's all I'd say. Very general advice, but yeah.
Yeah, man, I think it's absolutely perfect advice and underrated in the sense that do it your way. Is that it looks differently from the other person, and that's fine. And you can get stuff done quicker, and maybe some other stuff done a bit slower. And I had a friend that I work with who just got married, and it's just like, well, you do have to make time for these things, and whether that's the focus this year versus other things, and whatever it looks like for you, it's what's your runway, and there's no checkpoints that you have to do this at that point, and maybe there's a general progression, but there's a few zigzags in the way, so that's fine.
I like that. I like that analogy. It's good.
Yeah, that was not bad. That was not bad. Came up with it just now, so that's all right. Well, I'll let you get going. Go walk the dogs. Thanks so much for coming on. It's been super exciting having a chat to you. I've been wanting to do it for a while, so keep on yeah doing your thing with BBT, and locum year, and also this YouTube stuff as well. It's really cool, and um, I'll put your links in the description for anyone who wants to check out your stuff. So yeah, thanks very much.
Thanks. I appreciate it. Always good chatting. Cheers.
All right, so that's the end of that conversation. If you want to be part of something like this, you think you have an interesting story in medicine to share, maybe it's how you got in, and maybe it's that you got on a different training program or you went through some adversity, that's something that you think you'd be interested in doing, then send me a message. The link will be in the description, how you can get in touch. If you know someone else that's probably keen to share their story, or you think that they would be a great person to share on this, then definitely link them in and we can get them on. If you want to stick around, there's plenty of other videos on here to check out and keep you informed, keep you interested, and keep you learning more about medicine. So there you go. Otherwise, we'll see you next time. Bye.